Bon après-midi. Merci de vous être joints à nous. Good afternoon. Thanks, everyone, for being here. Today, I am joined by my colleagues, Minister Mary Ng, Minister Anita Anand, and virtually from Thunder Bay, Minister Patty Hajdu. Since the onset of the COVID-19 pandemic, we have constantly adapted, as we must, to address this ever-evolving crisis. We recognize the challenges Canadian businesses face today are not the same as those they faced in March. Many have now reopened. But because they are doing the right thing, and because Canadians are doing the right thing, many businesses, including small businesses, can't operate yet at full capacity. One of our first actions was to introduce the Canada Emergency Business Account, or CEBA. CEBA provides interest-free loans of up to $40,000 to eligible small businesses and not-for-profits to help cover their operating costs, including rent, utilities, insurance, and, crucially, wages. These loans are fully funded by the Government of Canada. More than 200 banks and credit unions across the country are offering them to their customers. If the loan is repaid by December 31st, 2022, 25% of it will be forgiven. That means up to $10,000 in cash for participating small businesses. We introduced this program to help ensure that small businesses facing a sharp decline or collapse in revenue would be able to weather the COVID storm and bounce back afterwards. And I'm happy to report that as of August 27th, more than 730,000 CEBA loans have been approved, amounting to more than $29 billion for eligible businesses. Aujourd'hui, nous annonçons que la date limite pour la soumission des demandes en vertu du programme de CEBA sera rapportée au 31 octobre 2020. Cela donne aux entreprises 2 mois supplémentaires pour demander une prête de CEBA qui les aidera à traverser cette période difficile et, espérons-le, à en sortir plus forte. Pour faire une demande dans le cadre du compte d'urgence pour les entreprises canadiennes, les entreprises doivent communiquer avec leur institution financière. Les entreprises peuvent également consulter le site web canada.ca pour en savoir plus sur la procédure de demande de prêt. Plus important encore, j'annonce aujourd'hui que nous travaillons avec les institutions financières pour mettre ce programme à la disposition de certaines entreprises qui n'ont pas pu se qualifier jusqu'à présent. Cela comprend plus particulièrement les entreprises qui effectuaient des transactions à partir d'un compte personnel. Je tiens à souligner que les entreprises qui présentent des demandes devront toujours répondre à tous les critères d'admissibilité existants. Plus de détails sur ces changements seront publiés prochainement, y compris un nouveau processus pour l'ouverture d'un compte d'entreprise par lequel les entreprises admissibles pourront faire une demande. Nous faisons avancer les choses aussi rapidement que possible avec les institutions financières. Nous avons écouté les petites entreprises et nous agissons en conséquence. Today, we are announcing that the CEBA application deadline will be extended to October 31st, 2020. This gives businesses 2 extra months to apply for a CEBA loan to help them get through this difficult time and ultimately to emerge stronger. To apply for the Canada Emergency Business Account, CEBA, businesses should contact their main financial institution. Businesses can also visit canada.ca to learn how to apply. Crucially, today, together with my colleagues, I'm announcing that we are working with financial institutions to make this program available to some businesses that have been unable to qualify to date. This specifically includes businesses that have been operating using a personal account. I want to stress that applying businesses will still need to meet all the existing eligibility criteria. More details on these changes will be released very soon, including a new business account opening process through which qualifying businesses will be able to apply for CEBA. We are moving as expeditiously as possible with financial institutions. We've listened to small businesses, we have heard what you need, and we're acting. I'm also announcing today that we are extending the Business Credit Availability Program to June 2021. BCAP offers loans and guarantees to ensure businesses get the credit they need to keep operating and, importantly, to keep their employees on the payroll. Export Development Canada and the Business Development Bank of Canada will continue to work with lenders to support access to capital for Canadian businesses in every sector and region of Canada as they gradually and safely get back to work. J'annonce également aujourd'hui que nous prolongeons le programme de crédit aux entreprises jusqu'en juin 2021. Le PCE offre des prêts et des garanties pour permettre aux entreprises d'obtenir le crédit dont elles ont besoin pour continuer à fonctionner et maintenir leurs employés en poste. Exportation et Développement Canada et la Banque de développement du Canada continueront de collaborer avec les prêteurs pour soutenir l'accès au capital des entreprises canadiennes dans tous les secteurs industriels et dans toutes les régions du Canada, à mesure qu'elles redémarrent leurs activités d'une manière progressive et sécuritaire. Our government stands by and will support Canadian businesses through this difficult time. Small business is at the heart of the Canadian economy and of our communities. Your success is critical to the safe and sustainable restart of our economy. And we know that our fight against the coronavirus is not over and that these are very unpredictable times for Canadian businesses as a result. As we move ahead, we must and we will adapt our government programs as needed. We are committed to supporting small businesses and to listening to small businesses to hear exactly what it is you need. We will do whatever it takes to keep Canadians and the businesses on which our jobs, our livelihoods depend, healthy and solvent, so that together we can emerge from this crisis stronger than ever. Okay, now we will also hear from our Minister of Small Business, Export Promotion and International Trade, my colleague, Mary Ng. After that, we're going to hear from the Minister of Public Services and Procurement, Anita Anand, and by video link, our Minister of Health, Patty Hajdu. So, Mary, over to you.
Thank you so much, Deputy Prime Minister. Good afternoon, everyone. Bonjour tout le monde. As always, I want to begin by speaking directly to our business owners and our entrepreneurs. And I know this has not been an easy time for you, and yet through all of it, you have shown resilience and patience. You've made incredible sacrifices through worry and in the face of the unknown, temporarily closing your doors to keep more Canadians safe and adapting your business models to keep as many employees on the payroll as you possibly can. You've created the tools to help our frontline healthcare workers take care of more patients safely. You've donated meals to the ones who are on the front line. You've shifted your businesses online. You've come up with creative solutions through these uncertain times to meet the needs of your customers. Vous êtes au cœur de nos communautés et le moteur de notre économie. I'm listening to you. We are all listening to you. And we are working hard to create the kinds of supports you need now and those that you're going to need on the road to recovery. From the very beginning of this pandemic, we heard that you needed help with liquidity and with cash flow. And over the last few months, we've brought in a wide range of lending supports, including the $40,000 interest-free CEBA loan that the Deputy Prime Minister and Finance Minister just spoke about. We have seen over 730,000 business owners benefit from this so far, including many sole proprietors and business owners who depend on contractors, but we know that there are more business owners and entrepreneurs who will still need our help. So we've been listening, and we know that this support is going to be crucial for small business owners as we begin to rebuild our economy. That is why today we are extending the support through to the end of October. And then to help our larger businesses with higher operating expenses. On the same road to this recovery, we, of course, created the Business Credit Availability Program, or otherwise known as BCAP. These are loans that go up to $12.5 million, and for mid-market businesses, loans that go up to $60 million. And today, as you heard from the Deputy Prime Minister, we're announcing that these loans, which also are available through your financial institutions, are being extended through to the end of June of 2021. And for small business owners and entrepreneurs who are operating out of their personal bank accounts as opposed to business accounts, we're working closely with the over 200 financial institutions from across the country to make sure that you get the support, and we'll give you those details in the coming days. Nous avons parcouru un long chemin et nous avons de quoi être fiers en tant que pays, en tant qu'équipe, Canada. But for Canada to truly lead in the post-COVID world, we will continue to support you, our business owners across the country, as we rebuild. This is going to be crucial. This has not been easy, I know that, and the road to recovery is going to take just as much grit and resilience from all of us, and certainly from our small businesses whom I've had the pleasure of speaking with, working with from coast to coast to coast. And as we continue to rebuild and to recover, I want you to know that we're going to continue to listen, and we will continue to work with you. We will continue to take the bold action that is needed to support you on this road to recovery every step of the way. As we've been saying all along, we are going to continue to have your back. Merci beaucoup.
Okay, thank you very much, Mary. And now we will hear from our Minister of Procurement, Anita Anand. Anita, please.
Thank you so much, Chrystia. Alors que la fête du travail approche et que les parents, les enseignants, le personnel du secteur de l'éducation vivent un retour à l'école sans précédent, nous réalisons à quel point le COVID-19 a affecté nos vies. J'apprécie sincèrement les efforts déployés par les travailleurs de première ligne dans les domaines de la santé et des services essentiels. C'est inspirant de voir autant de Canadiennes et de Canadiens faire leur part en travaillant ensemble dans la lutte contre la COVID-19. Today, I'd like to discuss our vaccine strategy and vaccine procurement. Acting on the advice of the government's COVID-19 Vaccine Task Force and Health Canada officials, we continue to persevere to ensure that Canadians will be well placed as soon as a safe and effective vaccine becomes available. Our strategy is to secure agreements with numerous developers of vaccine candidates so that Canadians are well positioned as clinical trials advance among these developers. Diversification in our vaccine contracts and in our supply is crucial. It is important to take a moment to highlight the complexity of the environment in which this vaccine procurement is occurring. Concluding these contracts is not simply a matter of distributing a standard form contract and having vaccine suppliers simply agree to our preferred terms. The environment is intense. The demand is high, and each negotiation is unique. We must take into account the science as well as the doses price, manufacturing, and finishing parameters of each vaccine. What this means is that we are announcing the agreements and the details of these agreements separately. We have been and continue to act aggressively with tenacity and determination in order to be able to make announcements about our vaccine procurements. Our efforts are producing results. We are investing in a diverse portfolio of vaccines to ensure that as the science progresses, Canadians have access to a safe, effective, and proven vaccine. Recently, I announced the Government of Canada's agreements with Moderna and Pfizer to acquire their respective vaccine candidates. Specifically, the agreement with Moderna gives Canada access to up to 56 million doses of the vaccine. And the agreement with Pfizer provides access to a minimum of 20 million doses, and we are in advanced negotiation with Pfizer to add options for more. Today, I am pleased to announce that Canada is adding to its portfolio of potential vaccines through the signing of agreements with Johnson Johnson and Novavax. The agreement with Johnson Johnson will provide Canada with up to 38 million doses of its vaccine. The agreement with Novavax adds up to 76 million doses. Aujourd'hui, j'annonce que le Canada fait un ajout à sa gamme de vaccins potentiels grâce à la signature d'entente avec les compagnies Johnson Johnson et Novavax. L'entente conclue avec Johnson Johnson nous donnera accès à un nombre de doses pouvant aller jusqu'à 38 millions. L'entente conclue avec Novavax nous procure 76 millions de doses supplémentaires. Notez bien, all vaccine candidates must undergo successful clinical trials and receive Health Canada authorization prior to being distributed to Canadians. We now have access to 4 potential vaccines and have secured a guaranteed minimum of 88 million doses, with options for an additional 102 million doses at Canada's discretion for a total of 190 million doses. Canada is actively pursuing additional vaccine candidates, and I will be back to you and to all Canadians with more details on these additional contracts in the coming weeks. Our government has remained proactive so that we are prepared to protect Canadians who choose to be vaccinated. Now, in addition to the vaccine candidates themselves, we are also procuring supplies that will be needed in the manufacturing and packaging stages of vaccine production in Canada. This includes the materials needed to support safe and effective immunization, such as syringes, needles, and alcohol swabs. Also, today, I am pleased to announce that we have procured 3 fill and finish vaccine systems from VanRx, based in Burnaby, British Columbia. These systems are the last portion of a vaccine production line, which allows vials to be filled and finished without human intervention, thus allowing a rapid rollout of vaccines while minimizing waste. In short, when a vaccine is ready, Canada will be ready. Bien entendu, cela ne constitue pas la fin de notre travail au-delà du développement continu, des essais ainsi que de la fabrication et de la distribution de millions de doses à travers le pays. Ces vaccins devront également recevoir l'approbation réglementaire de la part de Santé Canada. Ces étapes prendront du temps, mais elles veilleront à ce qu'un vaccin sécurité et efficace soit accessible à toute la population canadienne. In closing, today's announcement about additional vaccine procurements is yet another critical step in Canada's response to the COVID-19 pandemic, placing Canadians at the front of the line for a vaccine. Les Canadiennes et les Canadiens peuvent être assurés que nous continuerons de faire tout notre possible pour les garder en santé et en sécurité. Je continuerai de vous garder au courant de nos progrès à mesure que nous allons de l'avant. Nous devons, pour le bénéfice de toutes les Canadiennes et Canadiens, explorer toutes les possibilités pour les vaccins et c'est exactement ce que nous continuerons de faire. We owe it to Canadians to explore every option for vaccines, and that is exactly what we will continue to do. I will now turn to my colleague, Minister Hajdu, who will tell you more about the way forward. Merci beaucoup, Megwetch. Thank you.
Take it away, Patty.
Thank you very much, colleagues, and Minister Anand, Deputy Prime Minister. Well, listen, with the progress that we're making on procurement, which I am so grateful to my colleagues for their hard work, today I'd like to speak about the importance of vaccination. We know that vaccination is the most effective way to prevent the spread of infectious diseases, whether it's childhood illnesses, seasonal flu, or a new virus like COVID-19. And despite vaccines saving lives worldwide, we also know that some people worry about the safety and effectiveness of vaccines, especially when it comes to new vaccines. So I want to be very clear. Health Canada will not authorize a vaccine unless scientific evidence demonstrates that it is safe and effective. Before any vaccine is authorized for use in Canada, it is subject to thorough assessment by Health Canada, and this will not change for COVID-19 vaccines. Now, typically, vaccine development takes several years because of the complexity and the significant investments that are required, both from a financial perspective, but also from a time perspective. However, in the response to COVID-19, we're seeing global vaccine candidates being developed at an unprecedented speed. And significant resources and investments have been made globally to mobilize key resources and respond to the urgent need that we see worldwide. But even in this accelerated environment, Health Canada officials are working around the clock to ensure Canada is well prepared once a safe and effective vaccine becomes available. Our team is working incredibly hard to make sure that all potential vaccines or treatments for COVID-19 will be safe and effective before they become available in Canada. So I'm going to conclude today by repeating just how important it is for all of us to do our part while others are working on potential COVID-19 vaccines. You can play a role by keeping your vaccines up to date, making sure that you get the seasonal flu shot when it becomes available later this fall. Vaccines don't only protect you and your family, but they also protect people around us that might be vulnerable. And these collective actions are key to protecting the health of our communities and our families and reducing the burden on our healthcare system. If you have questions about vaccines, I encourage you to seek out reliable and trusted information from reputable sources, including your family doctors, local public health units, or by visiting Health Canada's website. We will always be there to ensure you have the information you need to keep your family and your community safe. Thank you.
OK, thank you very much, Patty. Et nous sommes maintenant prêts à répondre à vos questions.
Thank you. Merci. Please press star 1 at this time if you have a question. Puis vous pouvez appuyer sur étoile 1 maintenant pour poser une question. Please limit yourself to one question and one follow-up. Veuillez s'il vous plaît vous limiter à une question et à une sous-question. There will be a brief pause for the participants to register for questions. Il y aura un délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Thank you for your patience. Merci de patienter. Our first question is from Mia Rapson from the Canadian Press. Please go ahead. La parole est à vous.
Hi, my first question is for Minister Freeland. The announcement today of the extension of CEBA, or the application through CEBA, it sounds like small businesses are happy to hear that, but they are anxious to know if there's going to be any changes made to the rent relief program, if it will be extended or if it will be expanded in any way. I'm wondering if you could speak to that at all.
Okay, I'll make a few comments, and then I think Mary might have a few things to say also. We are very aware that rent is an important fixed cost facing Canadian businesses, Canadian small businesses. Rent in general and the CECRA program in particular is something that I have been discussing very intensively with provincial finance ministers over the past few days. And we're really aware, as Mary and I said in our comments, that there are a lot of small businesses across the country that are doing the right thing, and a lot of Canadians who are doing the right thing. And what that means is there are a lot of small businesses who simply can't operate at 100% capacity right now, but many of their costs are still at 100%. We know that poses a real challenge. We are committed to finding ways to support them, to finding ways for them to have a bridge to the time when we have definitively vanquished the coronavirus. And we're working very, very hard and very urgently on that. Mary, do you want to add anything?
Yes, thank you so much, Chrystia. And to those businesses out there who need this support, I want to assure you that we have been listening to you, and we're working diligently and hard to get the support to you that you need. And I know that today is the end of the month, and I know that there are many businesses out there who are anxiously awaiting for a response from us. And I just want to assure you, we're absolutely working on that. And as Chrystia said, nothing is more important than to help you bridge through this very difficult period. We have done that. What you've seen the government do is adapt, and to adapt by listening to what businesses have been telling us. And on this program, absolutely, we have heard from our businesses and from our entrepreneurs, and know that we are well working on a solution.
Yeah, and I would just like to add, speaking directly to landlords, we would also really like to see you step up and play your part. The whole Canadian economy, the whole economic ecosystem is going to do better if we can all work together, landlords, provinces, the federal government, to keep our small businesses going.
And my second question, I think, is for Minister Hajdu. You talked about the need to convince Canadians of the safety of vaccines. I'm wondering when your government will be making a decision about the vaccine being mandatory, and what factors are going into that decision?
Well, let's be clear. No vaccines are mandatory, federally mandated to be used in Canada, and COVID-19 vaccine would be no different. In fact, there are some rules around, for example, school admissions provincially for children to be vaccinated for common childhood diseases. There are always exceptions to those rules, which are carefully managed by each jurisdiction. We believe that people have a choice in Canada about whether or not to be vaccinated, but we also believe that we have an important responsibility as Canadians to take vaccinations to protect our communities. And we also know that there are circumstances where people cannot receive vaccines because of a variety of underlying health conditions, for example, or other circumstances. So our job at the federal government is to make sure through the collaborative work of all ministers that we have access to effective vaccines, and that we continually work with Canadians to ensure that they feel comfortable and safe receiving those vaccines.
Thank you. Merci. Our next question is from Hélène Bigetti from Le Devoir. Please go ahead. La parole est à vous.
Oui, bonjour. Ma question est pour la ministre Anand. Vous m'excuserez si ce sont des questions évidentes, mais je ne couvre pas ça souvent. Donc, c'est concernant votre entente signée aujourd'hui là, sur les vaccins. Je voulais savoir, faut-il que le gouvernement paye pour bloquer ou comme ça réserver des vaccins auprès d'une compagnie? Vous dites aussi que vous signez des ententes avec plusieurs compagnies pour s'assurer que l'une d'entre elles arrive avec le vaccin. Mais si c'est la compagnie 1, par exemple, qui développe, qu'arrive-t-il avec nos contrats avec les compagnies 2, 3 et 4? Merci.
Merci beaucoup pour la question. Je voudrais commencer avec notre stratégie. Notre stratégie est d'avoir plusieurs contrats avec plusieurs fournisseurs. pour assurer les Canadiens que quand un vaccin va être développé, nous avons l'accès de ce vaccin. Donc, dans les contrats, nous avons un base nombre de doses et ensuite aussi des options dans tous les contrats pour acheter des autres doses. Parce que maintenant, nous ne savons pas quel vaccin va être réussir. Donc, c'est important d'avoir plusieurs options pour les Canadiens et Canadiennes.
Oui, vous n'avez pas vraiment répondu à ma question. Je vous demandais s'il faut payer pour bloquer ces vaccins et qu'est-ce qui arrive avec les contrats avec les compagnies qui n'auront pas été choisies. C'était ça ma question.
Non, il y a des détails que j'ai déjà donnés à vous aujourd'hui, mais nous sommes en négociation avec des autres fournisseurs aujourd'hui et dans les semaines prochaines. Donc, ce n'est pas prudent pour moi de expliquer tous les détails aujourd'hui, mais la prochaine fois que je vais vous parler, j'espère que je peux vous donner ces détails aussi.
Thank you. Merci. Our next question is from Wency Leon with the Globe and Mail. Please go ahead. La parole est à vous.
Oh, hi there. I was wondering if you might be able to clarify, with the agreements with the for candidate vaccine suppliers, what role would Canada have in the production of the vaccines from these suppliers?
Thank you so much. It's a very good question. Of course, the procurement of a vaccine involves the production and the distribution as well of a vaccine. And in our negotiations, as I mentioned, with several suppliers, the production aspect of the vaccine does take place in countries outside of Canada of the vaccines that I have mentioned so far. However, you will note that today the Prime Minister and Minister Baines announced that we will be funding additional money with the National Research Council in Montreal, and we will invest $100 million over 2 years to build the new facility there. So the government is taking production in Canada very seriously, as this announcement made today indicates. And in addition, you will note also that we have contributed $600 million plus to furthering research in Canada. And so it's very important to remember that the Canadian angle of vaccine production and procurement has not left our minds, that we need to make sure, just as we did with PPE, that there is a Canadian answer here. And so we are pursuing numerous procurement strategies with numerous suppliers at the same time to make sure that Canadians are well placed when a vaccine is found.
Thank you. Merci. Our next question is from Geneviève Norman with Radio-Canada. Please go ahead. La parole est à vous.
Yes, thanks for taking my question. And it's going to be on a very different topic. My question is for Minister Ng. And the topic is the lobster industry in Atlantic Canada, because the U.S. administration has launched a trade investigation to assess the impact of Canada's lobster exports on the U.S. industry. So I was wondering how concerned is the government of Canada into this new investigation that has just been launched?
Thank you for that question. And we, of course, are aware of the investigation, and we will keep a close eye monitoring the developments. I can assure the lobster industry we will be doing that. But it was just a couple of short weeks ago on my virtual tour to Atlantic Canada that I had an opportunity to meet with the lobster industry. And in our conversation, We talked about a range of issues, one of which is the access to the market in CETA that the lobster industry, but frankly, all Canadians have greater access to about 500 million new customers through the CETA. And it's great that I get to sit here next to the Deputy Prime Minister and the Finance Minister, who had a little something to do with that agreement. But suffice it to say that we will always defend our Canadian industries, our businesses, and certainly the lobster industry can count on our government to keep working for you.
Thank you.
Thank you. Merci. Our next question is from Mike Lecouta with the Global National News. Please go ahead. La parole est à vous.
Hi, my first question is for Minister Anand. I just wanted to know, you mentioned how difficult it is in these negotiations. We also learned that we lost out on the CanSino deal. What can you say to Canadians, though, to reassure them that we won't be at the back of the line for a vaccine, seeing as how a number of other countries have already announced these types of agreements, and the agreement that was announced today, one of them anyways, is of a stage 2 vaccine, where others are already, much further ahead at stage 3.
Question. I want to begin by indicating that the 4 vaccine procurement contracts that we have announced to date are significant in that they ensure that Canada is going to have access to millions of doses of vaccines when they are developed. Of course, as you suggest, each vaccine company is undergoing its own stages of clinical trials, and that reiterates the importance of our strategy, which is to ensure that we have multiple contracts in place with multiple suppliers, because at this stage, no one knows which vaccine is going to be successful. Therefore, we need to have many options on the table for Canadians. And I will assure you that we are not on a frolic of our own in this decision-making, that our procurements are following the advice of the Vaccine Task Force, as well as Health Canada and our Minister of Health, and we will continue to procure vaccines from multiple suppliers so that if there are vaccine developers who are unsuccessful with their candidate, we have other options available for Canadians. And in addition, we have options in those contracts to procure even more vaccine doses for Canadians should that need arise.
And just as a follow-up, I'd like to ask Minister Hajdu, your government has had a hard enough time trying to convince people to wear a mask. How are you going to convince people to take a vaccine?
Well, thanks for the question. As a matter of fact, we have actually the majority of Canadians understand the value of vaccines. And, we don't see the same kind of vaccine hesitancy that we see in other countries around the world. And so we're starting from a base of Canadians that, in fact, understand the value of vaccination, understand the importance of protecting themselves, their families, their children, and their communities. Of course, Canadians will have questions about new vaccines, especially in the context of COVID-19. And I think it's very important that we continue to communicate with Canadians like we are today, every step of the way in terms of vaccine production, procurement, Canadian production of vaccines, the research that's going along with it, and ensuring that we have an ongoing and robust communications approach with Canadians so that they can get all of their critical questions answered. This is a very important question because, in fact, it speaks to some of the misinformation that's purposely disseminated online and through social media to frighten people about vaccines. And that's why it's so important that Canadians use credible sources when they're looking for information about this vaccine and any other. And we'll continue to do that hard work of communicating with Canadians in a variety of different ways so that they have access to credible information that can protect themselves and their families.
Thank you. Merci. Our next question is from Jacques Galland with the Toronto Star. Please go ahead. La parole est à vous.
Hi, my questions are for Minister Freeland, and the first one is this the end of CECRA, or does the government intend to still renew it at a later date, extend it at a later date?
So as I said when Mia asked about it, we are very aware that rent is an important fixed cost that many Canadian small businesses are facing. I have been talking just over the past few days with many of the finance ministers of the provinces and territories about ways that we can support Canadian small business, including when it comes to covering their fixed costs, of which rent is a very, very big share. We're working on it, and we're going to have more to say about it very soon. Mary, do you want to add anything?
Not very much other than what we said a little earlier, which is we continue to work with businesses in this country, and you've got our commitment to doing that. The fixed costs like rent is really important, and we want to be sure that we help businesses continue to manage on this road to recovery with the supports that they need so that we can get to the other side of this recovery.
And my other question is following up on something you said earlier, Minister Freeland, about you'd like to see landlords step up and play their part. Was the government finding that not many landlords were applying for CECRA in the first place?
I said what I meant, which is I think right now we need a real team effort of the whole country to keep on fighting coronavirus and to keep our economy going as we fight coronavirus. And that means we need everyone to do their part. We need the federal government to do our part. We need provinces, territories, municipalities to do their part. We need banks to do their part. We need landlords to do their part. We need consumers and Canadians to do their part. And, you know, by and large, I think as a country, we have done really, really well. We have done a good job of taking care of ourselves and each other. We have to keep on doing that.
Thank you. Merci. Our next question is from Tom Perry with CBC News. Please go ahead.
Hi. My first question is for Minister Anand. Minister, can you just explain, you were talking about Canada being at the front of the line when a vaccine is developed. Can you just explain how does that work? I mean, once a vaccine is developed, who decides who gets it first? And I guess, is Canada at the front of the line, the middle of the line? Where do we stand?
The important point to remember is that the mere existence of these contractual arrangements places Canada well ahead of most countries. That's the first point. The second point is within the contracts that we are negotiating, we have built-in delivery dates as early as first quarter of 2021. In some cases. And I will say that those delivery dates, of course, are contingent on the big if, which is that we need to make sure that the vaccine is ultimately successful. But we are being very aggressive in our negotiations regarding delivery dates, regarding making sure that Canadians have those vaccines when they are discovered. We are putting in place fill and finish and other production processes to make sure that once the vaccine is developed, Canadians will have access to it. And so, in other words, we're doing every single thing that we can do from procurement to production to make sure that at the moment the vaccine is discovered, Canadians have access to it.
And Minister Hajdu, if I could ask you, you're talking about trying to persuade Canadians, convince them that this vaccine is safe. Is there, I guess, a level of uptake? How many people have to agree to take the vaccine before it becomes effective in bringing the pandemic under control?
I'm not hearing anything.
Yeah, I know. I think Patty needs to unmute herself. There you go.
I'm famous for this. Thank you. Thanks for the reminder. I got so excited about the question, in fact, that I just started talking. But it's a really important question because it speaks to the notion of herd immunity, which obviously most people use and have heard about. But ultimately, at the end of the day, the more Canadians that are vaccinated, the better vulnerable people are protected. Because, in fact, that's the premise of herd immunity, is that those that can become vaccinated so that we can actually protect vulnerable people with, for example, immune systems that are compromised, newborns that may not be able to receive the vaccination, children that have underlying health conditions that are unable to be vaccinated, and the list goes on. So, what we're looking for is a safe and effective vaccine that can be rolled out in an ethical way. We're very grateful for the work of NACI, who will a Canadian organization that will help us prioritize how to vaccinate and who to vaccinate. But ultimately, the more people that become vaccinated, the safer all of us are.
Thank you. Merci. Our next question is from Tom Blackwell with the National Post. Please go ahead. La parole est à vous.
Thank you very much. This is a question for Minister Anand. It's sort of a follow-up to the last one. It seems like of the agreements that you've made with various pharmaceutical companies, the vaccine candidates made by Pfizer, Moderna, and Johnson Johnson would be sort of at the most advanced stage in terms of the trial process. With those vaccine candidates, several other countries have already made similar deals. Are we going to have to wait until they have received their vaccine? And if so, I know you talked about delivery dates as early as the first quarter. Can you be more specific about, sort of best case scenario when we might start receiving doses of vaccines from those companies, I guess?
So I think what you would really like is for me to have a crystal ball so that I can tell you which vaccine is going to be successful and which timeline we would be able to proceed on. But of course, what we are doing as a strategic option for Canada is to make sure that as soon as a vaccine is developed, we are at the front of the line for Canada. And the fact that there have been other agreements previously negotiated in other countries does not mean that the delivery dates in our contracts are negated. In fact, it's quite the opposite. We've been very aggressive about delivery dates in our contracts. We've been very aggressive about the need to get these vaccines to Canada when they are discovered. And we will continue to work with our suppliers, with whom we have a very strong relationship, to make sure that delivery occurs when a vaccine is developed.
So one company that you have not yet made an agreement with is AstraZeneca, which is working with the Oxford University vaccine, which many experts consider to be sort of the most promising and certainly most advanced at this point. I understand you are in talks with AstraZeneca. Can you give any sense as to where that stands? And again, I mean, AstraZeneca is saying that they hope, if the vaccine passes phase 3 trials and gets approved, that they hope to be able to start, delivering vaccine as early as the end of this year. Where does Canada stand with that vaccine candidate, and how soon might we have access to that?
Okay, well, thank you so much for that specific question. I will say that on a general level, we are continuing negotiations with a number of additional leading vaccine developers to ensure that Canadians have access to a safe and effective and proven vaccine candidate, and that no vaccine will be made available until Health Canada approval has occurred. In terms of AstraZeneca, I spoke with them on Friday morning, just that recently, and have been speaking with them regularly. We are in the final stages of our negotiations with that company, and we hope to have more to say in the future. I will say that it's very important, though, to remember that there is no silver bullet to a vaccine candidate. We must make sure to procure from multiple suppliers to ensure that Canadians have access to the ultimate successful vaccine candidate.
Thank you. Merci. There are no further questions registered at this time. Nous n'avons plus de questions pour le moment. This concludes today's conference. Please disconnect your lines at this time, and we thank you for your participation. La conférence est maintenant terminée. Veuillez s'il vous plaît raccrocher votre ligne et merci à tous les participants qui se sont joints.
OK, oui, merci tout le monde. Merci pour les questions. Thanks, Patty. Nice to see you, albeit on the screen.
Merci beaucoup.
See.